right, welcome back to another episode of Questions with Crocker with me, Dr. Crocker, and my husband, Shane.
Hi.
Hi. I was thinking about it. We always give golf updates, and we've kind of switched seasons a little bit, and now we are in football season. I feel like your mood is maybe going to be more related to football. So how was the weekend? Football watching? Was it great? Highs, lows? You doing okay?
It wasn't a great weekend.
It wasn't?
No.
I thought you enjoyed the Colorado game.
I did enjoy that game. Although I like TCU, but it was a good game.
Yeah, but we love a good underdog story.
LSU got beat. Never good.
Oh, okay. Did A&M even play?
Yeah, they won.
I'm like the worst Aggie ever because I was working in the emergency room. I'm an emergency veterinarian, for those of you new to the podcast, and it was Labor Day weekend. So I was working 10 to 10 was my shift. I was a swing shift. And so you were hanging out watching football while I did that. And it was a wild weekend. It was really fun. It was really busy. I got to work and train one of the new emergency vets that we have. So that was enjoyable. Dr. Smith is amazing. And we had some crazy cases. One of the craziest cases was we had a dog come in last night, and the dog came in respiratory distress. So he sounded like a freight train, breathing just really swollen in his upper airway. And he was a huge dog. And the owner reported that they went to her mom's house, and then driving back, dog started to get really worked up, had been outside only for a little bit, and then went home and continued to be really worked up and basically collapsed. So she rushed it right in. And I took this dog's rectal temperature, and I think I already told you what it was, but do you remember what I said?
110.
It was
maxed out.
It was greater than 110.
Yeah.
I was watching the thermometer, and it was like going up. It hit 110, and then it just said high. So it was over 110. And why that's terrifying is because anything over 106 is when your organs start to have major issues. And so we started active cooling. Owner was obviously very distraught. It was a really tough case, and we worked on that dog for a long time. But what happens is it's almost like you fry your insides when you get that hot. And so the brain can be damaged, and then you can start to have some bleeding issues. And the shock to the intestines causes you to have massive bloody diarrhea. So it was a case in which it presented, and I had not had a temperature that high yet. We live in Texas. It's been super hot, and we've been getting a heat stroke almost every shift right now. So pet owners, please keep your pets inside right now in Texas, or just avoid outside if you have a brachycephalic dog. But it was a crazy case, and one in which I was sad about the outcome, but my team did a really good job trying to save this dog. And it was just a reminder that there's certain things that we need to be really careful of this time of year. So our dogs don't go outside.
No.
We have an 80-pound lab, and I swear he thinks he's like a chihuahua. He goes outside, goes potty, and then comes right back in and acts like he can't be outside more than 5 seconds. So I think he'd be considered a lazy lab.
Yes.
You know, there's the working labs that actually have a job and want to do stuff.
His job is eating and sleeping.
On the couch when we're not home.
Yes.
He knows he's not supposed to be on the couch when we are home, but there's evidence of him sleeping on the couch. And the best is when I walk in and I wake him up from his nap on the couch, and he peeks his head up over the couch and gives me this look like, oh crap, you caught me. And then jumps off of it and pretends like he wasn't doing anything. So luckily he's cute, so it's okay. But working in the ER with the new graduate doctor was interesting, and she did a great job. And I think it leads into the question that we have today. And this is actually a question I got from multiple sources online, and I also got from the students that I went and spoke with at LMU just a couple weeks ago. And the question was, can you do emergency work right out of school? So there's a lot that goes into this. What are your initial thoughts on that question?
Technically, you can. There's nothing to prohibit you once you get your license to go do that, right?
True. So you graduate from vet school, and there's almost anything that you can do with your license. You really don't have to do an internship. A lot of human doctors have to do some sort of internship or residency training, but you can go into almost any type of work other than certain specialties when you get out of vet school. So technically, yes, you can. Now, whether it's a good idea or not, I would say the answer is it depends. And what I think part of that depends on is what type of emergency room you're going to work in. So just like veterinary hospitals, there's a huge variety, and we've seen that even in the places we've worked and we've lived. And there's different levels of care that can be offered. There's different equipment. And so some people might go work emergency in a more rural place where there's just not a lot of options for referral. And so they have to jump in and do emergency work. I think this person was talking more about a designated emergency facility or emergency specialty in a specialty hospital. And so similar to people, we have specialty hospitals for pets where there's an emergency room within the building, and then they have specialty centers in there too. And so a lot of those instances, the emergency veterinarian doesn't actually do surgery. You don't actually cut your own surgeries. You have the surgeons do it in the surgery team. And I worked at a facility like that. And the only time we would cut surgeries would be on the weekends if a surgeon wasn't available, and we didn't cut everything. And so now where I work is in a standalone emergency hospital, so it's only staffed by emergency veterinarians. We do not have surgeons on staff at every facility. So we as emergency vets are trained to do all the emergency surgeries that we need to. So I think it depends on where you're going and what expectation there's going to be for like appointments versus surgeries. As a pet owner, would you understand those differences if you were taking your pet to an emergency room?
No, I think you assume quality before you even walk in the door, meaning your assumption when you walk in is that that doctor is properly trained to take care of your pet for whatever need that it has.
And that is important, I think, for pet owners to understand that that's not always the case, because you get a lot of pushback sometimes if they go to the specialty centers and the emergency doctors say they need surgery, we have to call the surgeon in, or we can't cut it until this point in time, or we don't have a doctor here that knows how to do that surgery, and we have to refer you. And so I do think that is a little, I guess, not misleading to pet owners, but they just don't understand it. And it's similar to vet hospital. People see the word hospital and they automatically assume that you can do any and everything. And that's not really how every single vet hospital or vet clinic is set up. And so I think it is important to differentiate. The most common surgeries we do in emergency are going to be foreign body surgeries when they eat something they shouldn't. We're going to do GDVs where the stomach flips, and that is a true emergency surgery. And we are trained extensively in that. Splenectomies, if they're bleeding internally from their spleen having a tumor, that's a really common one that we do. And so those surgeries are not surgeries that every veterinarian does or is comfortable with doing, but we are at our facilities because we're trained to it. I would say as a new grad, that is not something that if a GDV walked in, you know, when I first graduated and they said, hey doc, this needs to be cut, I would be terrified because it is a really tricky surgery initially, and the anesthesia and how critical the patient is just overwhelming. So there's a couple important things I think people need to remember if they want to go into emergency right out of the bat. What are some of the things you think they should look at and would set them up for success?
Probably based on your independent needs. A lot of people are going to need a lot more mentorship or training or specific training in that field. So probably look for somewhere that either guarantees a mentorship or some additional training before you get stuck on the ship by yourself, and you know that walks in. So
100%. So when they're looking at these jobs right now, you can go and work in an emergency clinic because everybody's so short staffed. Like they will hire a new grad. The problem is sometimes they will hire a new grad and then they will teach you very short term and maybe not as fully as they should, and then you'll be on shift by yourself. And you're trying to manage critical hospitalized patients along with seeing outpatients, and it can be really overwhelming. When I actually worked at the specialty center I worked at, I had a local emergency doctor call me from another facility, and she had a pretty routine emergency issue. And so I was asking questions. She wanted to send it to us. We had a lot of, referrals because we were a specialty center, which is totally fine. But I just said, what did the ultrasound show? And she was like, I just graduated. I don't know how to ultrasound. And she just sounded so terrified and beaten down and not supported. And I didn't give her a hard time over not knowing, but I would say that knowing how to do an ultrasound and a fast scan is an essential skill of an emergency veterinarian. And if you are hiring people and not teaching them that and not setting them up for that, you're doing a disservice to your pet patients and also to that person. And so she sent it to us, and we, took care of the pet for her, and obviously wanted to help out a colleague. But it was surprising to me that she'd been hired on, and then it didn't seem like she had gotten kind of the training and support she needed. And you could tell just in how she was talking to me that she just felt worn out and beat down. And you don't want that in a new grad. You want them to feel supported and encouraged. And like you said, help them develop the skills that they need. So I think intentional training is one of the primary things that you need to make sure that you get. So what are some of the questions that a new grad should ask when they're looking at emergency jobs?
Yeah, I think you definitely need to ask those questions, right? What additional training am I going to get? Is there going to be somebody on site with me at all times? Are they a phone call away and immediately come in if I need help? How long am I going to be here before you turn me loose by myself? There's probably 100 questions you can ask, but I think you have to ask them in two places. You ask the person that's hiring you, but then also spend some time talking to the other associates that are in the practice to figure out what they received and are they going to be around to help? Because I think that's a true story. A lot of times when you're trying to hire, you're going to say whatever you think that person wants to hear,
right,
to hire them. So I think as a young veterinarian coming in, going to interview, you need to also ask associates or other people, technicians on the floor, so you can get the real story, if that makes sense.
Yeah, because that does happen where people will say, yes, we mentor, yes, we do this.
Yeah, is that just a person or is that a program?
Exactly.
Right?
Well, and the person telling you that they have things in place aren't usually the people teaching you. And as an emergency vet that does teach new grads, it is an extra emotional and mental burden to have somebody that is on shift with me when I am seeing a ton of patients and helping them with their cases and trying to kind of manage and oversee everything. That takes a lot. Now, I love it. I love working with new grad veterinarians. I think the training program that we have laid out is so intentional that it's pretty easy to do. But you still have to enjoy taking that extra time, teaching, answering questions. You have to be available. I can't be checked out when I'm on shift. And so you would want to know who is going to be training me, who is going to be in charge of that. And I would probably want to talk to that person and just see if you are comfortable with them and if you feel like you get along and if you feel like they will actually be there and that they are aware that they will be training you. Because I've had some people say, yeah, apparently I'm supposed to train and that was never part of my job description and I don't get paid extra to do it. And I don't want to.
Yeah.
I don't like training. And that isn't really fair to, one, the employee who's being asked to do something they don't really enjoy and they don't want to do. And two, to the new graduate who really needs that support and needs that mentorship. So
I think also as a new grad, back to the original question, can you go into veterinary medicine right out of vet school? I mean, emergency medicine. Some of that is dependent on that individual.
Mm-hmm.
Is the personality of that person one that can handle the stress and the fast pace of emergency medicine, but also knowing realistically what skills you're kind of lacking and to intentionally go out and learn and get training and ask for help in those areas. If you're one that's going to kind of sit back and figure it out as it comes, that's probably not the place you want to go right out of vet school. I mean, if you know, hey, I need to tighten up my surgery skills or I need to get better at ultrasound or whatever that is, they need to be intentional going in that we're going to get this figured out pretty quick.
Yeah. And I think, honestly, when they graduate, I think most of them have a good idea because you should have worked emergency somewhere before you decide to go into emergency medicine. Let's just get that right out there. In general, whatever you decide to do after vet school, hopefully you have experienced that. You have done that during your externships. You know that type of pace, culture, cases you're going to see is what you really enjoy. So that is a given, or it should be. And then on top of that, you should kind of know from being in the emergency room, man, I really don't feel comfortable in surgery, or I think I need to work on my imaging. Or the other big one is client communication, which we'll get into in a minute. One thing that I think is also important to ask as a question is staffing ratio. So it is really important, especially in the emergency with the pace, that you have good staff that is trained well as a new grad, because there's a lot of things even now I will say, okay, this is my plan. This is what I'm thinking. And I will turn around and talk to, the technician that's working with me and say, this is what I think I'm going to do for anesthesia, or this is what I'm going to do for this laceration. What do you think? And I will get really good feedback from these technicians that have been doing ER for a while. Like maybe we should adjust our sedation or anesthesia protocol a little bit based on the pet and how they're acting. And maybe cost-wise, we need to make some changes to our estimate. But I think having those team members that are also very practiced and willing to work with new grads is important. And if you ask them, what is the staffing ratio? And they say like 1 to 2, so 1 veterinarian for 2 technicians, and they're not even trained up. They're like new technicians to the field, and you're doing hospitalized patients and outpatients, you will be drowning. I go on the floor in the ER, and I have several people available, and I can manage multiple cases at a time because my team is so well trained and they can communicate well to owners and they can do a lot. And so even we had a lot of bite wounds the other day because it's the holiday weekend and people are like out with their dogs and they have people visiting. And there was a couple we had to bandage, and, I came up with a protocol. I came up with a plan. I checked the wounds, made sure, but they did the anesthesia. They cleaned the wounds for me. I just made sure there wasn't big pockets. I sutured if I had to, and then they put the bandage on. So my time with that case was actually much less because my team is so well trained and they can do all those things. And so I really think that support of the overall team is important too as a new grad, and not just your one-on-one mentor that you're going to have on shift. I think it needs to be everybody as a whole. So those things are really important. And I feel really strongly about the intentional training because we have such an intentional training program through Veterinary Emergency Group. And over 6 months, you do training where you travel and you do ultrasound, surgery, endoscopy, and exotics training. And then on the floor, it is very much, you watch us do things and you start to take primary on simpler cases and you move up to more difficult things along the way. And then at the very end of your training, you're doing paired practice where you're with one of your other new grads, but you have other senior doctors available and you're starting to take like full shifts together. And so because I've seen such intentional training, I feel really strongly that it needs to be that way and you need to have a team that will support them. Now, what do you think are the hardest parts of working ER? Like obviously there's emergencies and pets are dying, but what do you think the hardest things are overall?
Probably just dealing with the actual pet owner. I mean, it's a stressful situation. It's probably a high call situation. It could be touch and go with their pet. Being able to communicate that and handle that level of stress for an entire shift day after day is probably a lot.
It is. I would say that if I just had to deal with the pets and what they had going on and just the medical and surgical part of it, even though it's sad sometimes and you lose patients, my job would be much easier. The hard thing is you have a very emotional situation where most of the time something sudden happens. They didn't know it was going to happen. And then you are having to give difficult news. And on top of that, you are having to say, I can fix this and here's the cost, or I can maybe fix this and here's the cost, or I can't fix this at all. Your pet is going to die and you need to put them to sleep. All 3 of those conversations are really difficult to have. And it does take a certain level of communication, training, and just getting to feel people out, kind of determine how you're going to present things that I don't think that they can, as much as vet schools want to do communication training and they actually act out scenarios and stuff, I think until you're in it with the actual owner and the actual pet, you still don't really know how you're going to handle those situations. And then you mentioned, just emotionally for both parties. I think emotional resilience is something that you have to kind of teach and train yourself also. I'm not a veterinarian. But I'd have to think if you're working at a general practice, you probably get some euthanasias because you have older pets that maybe, that you've been dealing with for a while. It's just time. But I've got to think the amount of euthanasias in emergency medicine is probably significantly more than, in a general practice. And even with the general practice, a lot of times maybe they anticipate this is coming at some point. But in an emergency setting, it could be, spur of the moment. This just happened, right? So just being able to handle that emotional piece is probably a lot for a new grad that maybe is still thinking they're just going to take care of puppies and kittens all day. So, well, and when you talk about euthanasias, that's not really something that you can let people experience until they do it. Because when you do euthanasia, like, you're not going to be like, hey, this other vet's going to come in here and like be in the room while we're doing it and see what happens. And even in school, when you're training, like, you're not going to have a group of vet students go in a room for euthanasia and watch the client and see how you interact. So as much as you try to play that scenario out, that is one of the few things that until you actually do it, you don't experience it. And what makes it harder, I think, in an emergency situation is the owners have no idea that it's coming. And like you said, in a GP, maybe you have a relationship with the person, you've seen them a couple of times, you can kind of prepare them and prepare yourself, this is going to happen. And they've already established like a trust with you where they feel like your hospital has tried what they can for the pet and you've been really empathetic and, you know, you've spent time with them. And I think that helps when it comes down to it. In the ER, I will have people just almost in disbelief because their dog was running around the day before and now they're in my ER and they're bleeding out. And they have to make a very quick decision to go to surgery, spend a lot of money for possibly still losing the dog, or they have to decide euthanasia. And every shift will hear someone say, they were just fine yesterday. They were eating fine yesterday. They were running around. Like, they were playing with my kid. And that switch in their mind is a really hard one to flip, that it is time, even though you're not ready. And so I do think, you know, we try to talk through those scenarios and teach and train them. One of the biggest things I see young vets struggle with, and I have people ask me this question, is getting really emotional also about the euthanasia. And it might seem harsh to say this, but I honestly tell them that this experience is the owner's experience. Like, they are emotional, they are upset, and that's okay. It's their pet. If we get like overly emotional and are like sobbing, crying with them, unless you have like a really strong relationship with them, I think it just adds to their emotion. And so I will tear up sometimes. I will, you know, comfort people, but I don't let myself get that emotional because I think it makes the situation more volatile in a way, and it doesn't allow them to kind of gather themselves if needed and like do what we need to do. And so that's probably one of the hardest things to teach a new ER veterinarian. And I think my record for euthanasias is I did like 10 in a shift over the holiday one time, and that was a horrible shift. It just felt like I was just, you know, giving and giving and giving. And after that shift, I was wrecked. And there's no way to prepare a new grad for something like that. And hopefully, based on what we've talked about, they wouldn't be in that position because they would be on shift with other people. And if I saw a new grad was getting a lot of cases where they had a lot of euthanasias, like, as their mentor, I would say, you know what, you need a break from this. Like, I'm going to take some of these cases, or I'm going to do this for you, or I'm going to, you know, take a break, take a minute, take some of the easy things that are coming in the door. Like, let me step in and help you. And I think that's really what you need to do. So yes, they can do emergency, but you really have to have intentional training. You have to make sure you have staffing and a team that's going to support you and wants to teach and support you. And you really have to focus on those things that you need to get stronger at and stronger with. You did a lot of sales and business stuff. Do you think you can train yourself to be a better communicator, or do you think that's more of an on-the-job thing that has to happen?
No, you can definitely train yourself. I mean, some of it's just in how you present things. And the more you do it, the more you get comfortable with that conversation. So I think over time you can be trained. But some of it too is personality. I mean, sometimes people are better at communicating than others, right? They're probably going to do that better. They're going to do that faster than somebody that is not comfortable with that. But that person that's not comfortable can still learn to be able to deliver those messages in a way. So I think it's both.
I agree. And I think if you start looking into communication training, and especially if maybe you have confidence issues, you can't not be confident in the ER. Like, you are giving very difficult information. You are giving, you know, plans and options that are, you know, high emotion. So you have to believe what you're saying and you have to say it with authority.
And I think a lot of times confidence comes with time. So if you see 20 of these same cases, you're going to be much more confident on number 20 than you were with number 1, right?
Yes.
So being a young vet coming out, you hate to say this, but sometimes you have to fake it till you make it a little bit, just because that's the nature of the business you're in. That patient, that owner is coming in looking at you for advice, and they want somebody to confidently say, this is what's going on, this is what we can do to fix it. Even if you're not 100% confident today, in 5 years you probably will be, because you'll see that same case multiple times. But I think it's one of those deals where you kind of have to fake a little bit till you make it, if that makes sense.
No, 100% I agree with that. But I think you do that by learning tools that will help you with that. So I've learned there's SEAL training breathing that you can do that actually helps physically slow your heart rate and relax you. So when you are, nervous about a procedure or you're nervous about a conversation, you can actually do breathing exercises that'll relax you so that you don't have that tremor in your voice sometimes that you can get, or you're not shaking. There's different poses you can do and different things that you can do mentally that will help, again, physiologically calm you. And so I do think that you can look into communication training, talking about eye contact, talking about reading body language. I don't think that it is just a process of experiencing it. I really think you can help yourself a lot, especially if you are dealing with a lot of imposter syndrome, which we all deal with, or you're dealing with communication issues. So I highly encourage people, especially where they have a job that they're communicating really difficult things, to not just think about what can I do in the hospital that is going to help me grow, but actually to look outside of the hospital. At conferences, they always have great training too. There's books, there's webinars, but the better you start to communicate in the emergency room, the better your shifts will go. A lot of the issues I see people struggle with is just communication. And so really focusing on that, yes, you need to get better surgery, your medicine needs to be solid, but man, the communication is what really gets the new grads and really can get them really frustrated about what they're seeing and what they're doing. So I think that is really, really important. And I don't always get it right. I would say, I have probably a couple people a year that really are difficult, and I feel like I'm doing the best job possible communicating, and I'm not going to make them happy. So no matter what, you have to, again, realize you can do your very best. You can try to save all the pets. You can communicate to the best of your ability, and you're still not going to always get it right, and you're still not going to have clients be satisfied because you work emergency, and emergency is hard.
So quick question, kind of change subjects a little bit. If you're coming out of school, you want to be in a certain area, geographically go back to where you grew up. Your passion and heart is emergency medicine, and there's a emergency hospital that is struggling, needs help, doesn't have very seasoned technicians, doesn't really have a very strong mentorship program, but this is what you want to do, where you want to go. Would you say jump in and figure it out?
I wouldn't. And I'm not trying to be negative. What I would say is you would be better off going somewhere and training intentionally for a year, 2 years, with good mentorship, with a high caseload, with good medicine, and where you can get extra surgery training, and then go back there and be able to be the doctor you need to be. But I think that if you don't have a good foundation in emergency, you're providing a disservice to your pet patients and also to the owners that are bringing them in. It is great to have a body in the ER. It's not great to have a body in the ER that doesn't really know what they're doing and is not confident. And I think you can cause more harm to yourself and your team and your patients if you do that. So that is where, I would say find that great practice that is going to mentor you. And even if you're only there for a year, if you really get great mentorship, you will be 3 to 5 years ahead of where you would have been if you went to that practice that didn't have that and was really struggling. And I know everyone's trying to hire, and they will throw big numbers at you sometimes, or if that's really where you want to be, that seems hard to do. But I really think you'll be a better veterinarian in the long run if you take that step first, personally. And again, we are not experts about everything. We say this every episode. This is just from my experience as a veterinarian for 14 years now, working different ERs and teaching and training for the past 2 years new emergency vets.
And seeing young vets coming out and doing this type of work. And
seeing young vets come out and set themselves up for failure because they don't choose where they need to go and ask the right questions. So hopefully from this episode, they'll have a better idea of what they need to look for if they want to go into emergency. I definitely think you can go into emergency as a new grad just to answer the question, right? But it depends where you go, whether you'll be set up for success long term.
Makes sense to me.
Awesome.
I would also point out that we're doing podcasts in the middle of the day and my phone is blowing up.
I'm so sorry.
Usually it's 11 o'clock at night and it's not.
I know. Well, I slept in a little bit because I worked late last night. So I appreciate you doing this with me in the middle of the day. I appreciate you guys submitting questions. The podcast is called Questions with Crocker because we want to answer whatever questions you have about emergency medicine, veterinary medicine, practice ownership, and just life in general as a veterinarian. So you can find us on Apple or Spotify and on social media at Questions with Crocker. You can submit questions to us through that or just send me messages through my personal social media. Everything will be in the show notes, and I appreciate you being here with me today. Oh, we're on YouTube too. You can actually watch our faces on YouTube.
Can't watch me on the last episode.
I accidentally deleted Shane's video from the last episode. So anyone who watches YouTube just to see your handsome face, I apologize. Episode 14 will not have him. You're stuck with me only. But this one, I'm going to get it right. So we're good to go. All right, you guys have a great day. Thanks for listening, and we'll talk to you again soon.